Welcome to Navigating IBD with Stephanie A. Wynn, where she tackles the real challenges of living with Crohn's disease and ulcerative colitis. Whether you're newly diagnosed, supporting someone with IBD, or looking for better ways to manage your care, this is your space for honest conversation, practical guidance, and community. This podcast exists to change the narrative, one story, one strategy, and one breakthrough at a time. So join Stephanie as she navigates IBD together with you. Y'all ready? Let's get started.
We are back. We are back for another episode of Navigating IBD with Stephanie Wynn. I am your host, and here we explore the stories, systems, and solutions shaping life with Crohn's disease and all things ulcerative colitis. This episode is brought to you by the IBD Patient Navigator Program. This is an initiative of the Stephanie A. Wynn Foundation that is dedicated to advancing health equity and improving outcomes for individuals living with inflammatory bowel disease in underserved communities. So today, friends, I want to talk about something that can change everything about how healthcare is delivered and received, and yet it's rarely discussed in team meetings or leadership reports. That missing matrix is empowerment. Not just empowered patients, but empowered providers. Let's talk about the gap between treatment and trust. What we measure versus what matters. You see, healthcare systems track satisfaction scores, compliance rates, readmissions. We measure wait times, documentation, completion, even patient volume. But here's what we don't measure enough. How empowered does the patient feel after every encounter? Do the patient understand their diagnosis? Can the patient explain their treatment plan? And do the patient know what to do if symptoms worsen at 2 a.m.? When I was diagnosed with Crohn's disease, I had the diagnosis, but I did not have the direction. The doctor explained the condition in medical terms I had never heard before. The doctor even provided prescriptions I couldn't pronounce. And I was even told to follow up in 7 weeks. But what about the days in between? What about managing work, relationships, daily life with a chronic illness such as IBD? You see, I left those appointments with prescriptions and a fog of confusion. And I had access to resources. So, for example, I had health insurance, I had education, and I had a family support system. But let's talk about it. Let's imagine for my providers and clinicians out here listening to this episode, imagine that same scenario for someone without those advantages. Now let's talk about the invisible cost of the gap. Here's what that gap looks like. First example, a patient who leaves with medication instructions they don't fully understand. The provider says, take this twice daily with food, but didn't explain why timing matters or what happens if they miss a dose. They take it inconsistently. 2 weeks later, they're in the ER with a preventable flare. Example number 2, a caregiver. A caregiver sits in the waiting room with questions, but unsure if it's allowed. They have notes about the symptoms and concern, but when the appointment ends in 10 minutes, they never get the chance. They leave without knowing what warning signs to watch for or how to support their loved one. And example number 3, a provider. A provider wraps up the appointment knowing they didn't have time to address real concerns. They saw the anxiety in the patient's face. They noticed the patient had unasked questions. They wanted to dig deeper, but there are 15 more patients sitting in the waiting room for the doctor to show up for them. The documentation is overdue. The system keeps moving. That patient doesn't take their medication correctly. They don't recognize the warning signs. They end up in a crisis. The readmission gets tracked, but the why, the breakdown in the communication stays invisible. You see, that's the gap between treatment and trust. For patients in underserved communities, that gap becomes impossible to navigate. And here's why the system fails connection. It's not a lack of compassion, it's structural. Providers, they juggle 15-minute appointments, prior authorizations, documentation requirements, and performance metrics that prioritizes speed over depth. They're measured on patient volume, not patient understanding. Meanwhile, you have patients that navigate medical jargon they've never heard, insurance barriers they don't understand, cultural and language differences that make self-advocacy harder, and a healthcare system that assumes they already know how it works. And here's the results, friends and family. You get miscommunication, mistrust, missed opportunities for healing, missed appointments, and it burns out the providers. When you can't connect the way you were trained to, when you watch patients leave confused, when the system isn't set up for what they need, that takes a toll. That takes a toll. This isn't a patient problem or a provider problem. It's a system problem. And here's why empowerment is the missing matrix. You see, empowerment isn't a number you can chart, but it's visible. You see it in the patient who confidently explains their symptoms, the caregiver who asks questions without hesitation, the provider who takes an extra minute to listen. You see, empowerment has to start with providers, not because patients aren't capable, but because providers control the environment where trust is built or broken. Hear me out. Patients don't set appointment length. They don't decide if caregivers are invited in. They don't determine if medical terms get explained or assumed. Providers do. And when providers have tools to communicate effectively and recognize barriers, patients don't just receive care, they have an experience. They become partners in their care treatment. And here's a different approach. You see, closing the gap starts with acknowledging that communication is a clinical skill, not a soft skill. That building trust impacts outcomes. That patient education isn't after treatment, it's part of the treatment. Does that make sense? That's why we develop the Empowering Providers to Improve Access to Care training through our IBD Patient Navigator program. This 6-session is a team-based experience that brings together doctors, nurses, social workers, care coordinators, everyone who touches the patient experience. It's not another compliance course. It's a cultural shift. The training provides practical communication tools, assessment forms to identify care gaps, and there's also implementation guides for real-world workflows and strategies for building trust with underserved populations. Because real equity doesn't happen through policies alone. It happens through the people, the very people that you serve. So here's a provider tip. I want you to lead with curiosity. Here's a shift you can make today. Lead with curiosity, not assumption. Instead of how have your symptoms been, try what's most important to you today. That question changes everything. And maybe they're worried about missing work. Maybe explaining their illnesses to their kids is very difficult for them. Or maybe they have an issue with the medication costs. When you lead with an open question, you find out what really matters. Other ways to practice curiosity is ask open-ended questions. Not, are you taking your medication? But tell me how the medication is working for you. And then check for understanding. Don't ask, do you understand? Try, can you tell me in your own words what you'll do when you get home? See, this changes the trajectory of everything because now you're listening. And then you want to acknowledge what you hear. That sounds frustrating, or I can see why that's concerning. That builds trust. Empowerment doesn't require more time. It requires, and I'm going to say this, it requires more intention. Those small moments of listening can mean the difference between a patient who shows up to follow-up appointments and one who disappears from their healthcare treatment altogether. So here's the takeaway, friends. Empowered patients are a reflection of empowered providers. I'm going to say that again. Empowered patients are a reflection of empowered providers. When healthcare teams communicate effectively and builds trust, patients become active partners. They ask better questions. They manage conditions more effectively. They're honest when things aren't working. And providers remember why they went into healthcare. They see better outcomes, less burnout, more connection. That's where healing truly begins. If your organization is ready to strengthen patients' trust and close the care gap, bring the empowering providers to improve access to care training to your organization. We're here to help. We're here to partner with you so we can help these patients show up for themselves and make better informed decisions. To schedule or to get more information about this session, visit the StephanieAWynFoundation.org. The link will be in the show notes, in the description notes of this episode. And listen, I want to thank you for tuning in to Navigating IBD with Stephanie A. Wynn. I am your host. If this episode resonated with you, share it with a colleague that's passionate about improving patient-centered care. Together, we can empower both patients and providers to create lasting change. Have an amazing day. Until next time, peace. Thank you for listening to Navigating IBD with Stephanie Wynn. If your healthcare team is ready to strengthen patient trust, improve communication, and close the care gap, the Empowering Providers to Improve Access to Care training can help. This 6-session program equips teams with practical tools, enhance the patient experience through collaboration, empathy, and equity. Learn more or schedule a session at the StephanieAWynFoundation.org. Until next time, together, we can create lasting change. Peace.